Thank you for joining us for today's discussion, what the One Big Beautiful Bill Act means for your 2027 benefits strategy. Before we get started, here are a few quick notes to help you stay connected and informed. Following the webinar, we'll send a link of the recording to all registrants so you can revisit the conversation or share it with your team. At the end of the discussion, a short survey will appear. It only takes a moment to fill out, and your feedback helps us shape future conversations that deliver the guidance and clarity you expect from Hub. And now I'd like to introduce our moderator for today's event, Corey Jorbin, Employee Benefits National Director of Compliance Consulting at Hub International.
Good afternoon and welcome to today's webinar, What the One Big Beautiful Bill Act Means for Your 2027 Benefits Strategy. I'm Corey Jorbin, National Director of Compliance Consulting for Employee Benefits at Hub International. Thank you for joining us today. Before we get started, just a quick word about Hub. So Hub International is a leading full-service global insurance brokerage and financial services firm. We are ranked among the top brokers in the world with more than 21,000 employees throughout North America. We bring expertise across risk, insurance, benefits, retirement, and wealth to help business leaders manage risk and build the kind of organizational resilience that holds up in an uncertain environment. Today's session is a reflection of exactly that commitment, and we're glad you're here. Last year, we ran our first installment of this webinar right after the One Big Beautiful Bill Act was signed into law. There was a lot of anticipation and a lot of changes, and there was a lot of unanswered questions. Here we are a year later, and we have more regulatory certainty in some areas. We still have some open questions in others. And for the first time, employers are asking not just what the bill says, but what they should actually be doing about it. That's the conversation we are here to have today. Before I introduce our panelists, I want to acknowledge that many of you submitted questions with your registration. We will do our best to address as many of those questions as we can today. And I want to note that while the provisions we are covering today apply across employer sizes and types, we know that many of you are managing these questions in a nonprofit or perhaps a municipality or a small employer context. We will make sure to speak to those nuances wherever we possibly can. Now I'm going to introduce our panelists, and today I'm joined by 4 of my Hub colleagues, 3 of whom were on last year's webinar. First, we have Employee Benefits Compliance Practice Leader, Dawn Smith. Dawn adds real depth to the regulatory side of this conversation. Tiffany Quarles is Hub's Health and Performance Practice Leader. Tiffany is going to take us deeper into direct primary care, including what this actually is, what this means, and what implementation looks like. Kim Cochran is Hub's Director of Client Services for Retirement and Private Wealth. Kim will be bringing us the latest on Trump accounts, including what's changed since we last spoke. And joining us on this panel this year, we have JJ Jackson, Hub's Senior Vice President and Absence Management Practice Leader. JJ is going to talk about something that we didn't cover last year, and that's the bill's provisions that connect to leave of absence, disability, and tax credits associated with paid leave. Now let's talk about what we're going to cover today. So we're going to start with compliance, and Dawn's going to talk about what guidance has landed since the bill passed, what this means for plan design decisions, and where the common pitfalls are that are already emerging. Then we're going to switch gears and head over to direct primary care, which Tiffany is going to cover. Tiffany's going to talk about implementation, who is direct primary care a good fit for, what to look for in a direct primary care provider. Then JJ is going to talk about Section 45S of the One Big Beautiful Bill Act. This is the paid leave tax credit. So this shows how paid leave, which is obviously a hot topic among employers, especially multi-state employers, but also how employers can potentially get tax credits associated with providing paid leave. And then finally, we'll wrap up with Kim, and Kim is going to talk about Trump accounts. We know that these are a very hot topic, and certainly some information has changed, but I believe there's also some still unanswered questions. As always, we'll wrap up with our key takeaways and next steps. And if time permits, we'll talk about some of the questions that we have received with your registrations. Now let's turn it over to Dawn for the compliance update.
Thank you, Corey. I want to start by really orienting you with how I'm going to frame this section. Last year in our One Big Beautiful Bill webinar, we went through exactly what changed from a compliance perspective. This year, I want to talk about the mistakes that employers are already making and maybe help you learn from those mistakes so you don't have them yourself. So let's start with telehealth. You might remember that I talked through kind of that roller coaster relationship that we had with telehealth first dollar coverage rules. But what does that mean for employers now that the One Big Beautiful Bill has made that permanent? It means that every year at renewal, you get the opportunity to decide what is best for you and for your employees. You can choose to charge full market value for telehealth and telemedicine services, or you can reduce it below, and even they have the option of eliminating it altogether. Regardless of the option you choose, it will not impact your employees' eligibility to contribute to an HSA. We have learned that telehealth services is really just a baseline expectation for employees. So this is an easier opportunity for employers to implement that coverage with little administrative impact for your employees. However, the one pitfall we really saw was employers trying to implement this mid-year. The reason that became a concern is we saw many carriers and TPAs push back regarding mid-year implementations. So as you're working through vendors, as you're determining what is the best avenue for you, make sure that you're communicating if that's going to be a renewal option or a mid-year change. We recommend that renewal option. Now let's talk about direct primary care arrangements for a minute. I'm not going to go too far into this. Tiffany will go much further in, but I do relate direct primary care arrangements like having a gym membership. You can go as many times as you want, or you cannot use it at all. However, employees who have these memberships can see their direct primary care provider as many times in a month as they want without having that per appointment fee. What the One Big Beautiful Bill did for employees is they made it where employees can not only continue to maintain HSA eligibility for contributions, but in certain circumstances, they can also use those HSA funds to pay for those fees. But like everything else with the IRS, there are rules and regulations associated with it. So I think it's important to talk about the pitfalls that we are seeing with these accounts. There are a couple of pitfalls that you're going to notice on the next slide. When we're looking at these pitfalls, there are two distinct questions that employees need to be able to answer. The first is whether or not their fee exceeds the cap amount of $150 per individual or $300 for more than one individual. If it exceeds that amount, they may not reimburse those fees from their HSA accounts. The second question will be whether or not their direct primary care arrangement is considered qualified. They have to make sure that that arrangement is only offering primary care services and is only operating through that fixed periodic fee. Any arrangement that's going to also include insurance or bundled services will eliminate their opportunity to continue to use their fees and contribute to that. Now, when we're talking about fees, there's also an aggregated point as well. Some employees might have multiple memberships. Multiple memberships do have to be aggregated together and stay below that cap. Now, let's talk about the topic that actually keeps me up at night, dependent care accounts. You might remember us telling you that for the first time since 1986, dependent care account annual limits have increased from $7,500 to $5,000. You might be sitting there listening to this thinking, that's exciting. My employees get $2,500 more of pre-tax. Why on earth does this keep Dawn up at night? It's the pitfalls. When we look at the different pitfalls, the most common issues are going to be testing and the failure of those tests. So when we talk about testing, I commonly hear employers not know that they have a testing requirement. Sometimes with your administrator, that administrator has a self-serve aspect, meaning you have to click a button or you have to request them to complete that testing. If you are unaware of that requirement, I strongly encourage you to reach out to your dependent care administrator and determine what their process is, whether or not anyone has ever tested, and what those results might have been. The next is the failure of those tests. We commonly see employers fail the 55% average test. The 55% average test looks at your total contributions from all employees in the year. And the test is expecting that the bottom 75% of your payroll is contributing at least 55% of those contributions. If they're not, the test will result in a failure. When you have a failure, an employer has an obligation to get to a passing result, which can mean imputed income or taxable income added back to your employee's W-2 at the end of the year. What I'm telling employers is be proactive. Talk about this early in the year. Do a preliminary pre-test with your administrator. If we're 3 months into the plan year and Corey has elected to contribute $7,500, but I've tested the plan and I see if he tests and he contributes more than $4,000, we will fail. I can go to Corey and say, Corey, we are going to stop your contributions at $4,000. We are going to stop before you get to those excess contributions. He may not be happy, but the alternative is we wait until the end of the year and then he has $3,500 that has to be added back as taxable income. Going to Corey and saying, I'm sorry, we weren't proactive, we didn't know this was going to be a problem, and now you have a surprise at the end of the year. He's going to be even less happy at the end of the year. So you get to choose your hard when it comes to the conversations that you have with your employees around these accounts. I just recommend being proactive in talking through it, but more importantly, make sure that your plan is actually being tested and that you have copies of those tests available in your fiduciary file. Now, a probably less common benefit offered, but I still think it is equally important, are the changes to student loan repayment benefits. Section 127 loan repayment is now permanent. For those employers who've been offering it, you can now rest easy and know that this isn't going to be a temporary offer. For employers who have kind of been on the fence of whether or not they're going to offer it, you're welcome to jump over the fence now, because now it's not just going to be a temporary offering if you so choose. But the exciting thing is they're going to index the annual limits as well. So right now it is set at the $5,250, but it will be indexed for inflation moving forward. So you'll expect to hear communication much like you do with FSA contribution limits and HSA. Now it's going to also include those student loan repayment. However, when we're talking about permanence, we also have to talk about, is it going to increase the compliance stakes, which of course leads us to the next slide of common pitfalls. While this might not be the most common benefit being offered, the biggest risk or concern I see amongst employers is the lack of a written plan document. You probably hear us talk about all the time when we're looking at ERISA or Section 125 saying, hey, you have to have a written plan document that memorializes the rules and the regulations of your plan. Section 127 is no different. The only difference is it's a different part of the code. Section 127 says that you must have a written plan document that's going to memorialize those rules, those regulations, and it must be written in plain language so that your employees can understand. But you also can't play hide and seek when it comes to the benefits that you're offering. And what I mean by that is occasionally I will ask an employer, do you have this offering? And their response will be, yes, but we only offer it to those individuals who ask. That's not okay. You have to make sure that you are offering this benefit across the board to everyone who should be eligible, not playing that hide and seek game. So when you're offering benefits, whether it's Section 127 or your group health benefits, you still have to look at those non-discrimination and make sure that you are not discriminating in favor of your highly compensated and that everyone is aware of the benefits that are available to them. We know compliance is not always easy, but we are always here to assist and help employers understand these common pitfalls.
Thank you, Dawn. So one question that I have, and I know many in our audience also have too, is if there's an employer that maybe they've had a dependent care FSA for 5 or 10 years or so, but they've never done non-discrimination testing, how should they get started? What would you suggest about prior years?
That's a great question. And as you know, it's a very common question. First, I would start with this year. Let's get this year cleaned up. Let's make sure you understand what this year looks like. And then from that point, work with your tax advisor, work with your administrator, and determine whether or not retroactive testing and retroactive changes are needed. Please remember, this does have tax implications, so we always will recommend that you have a tax advisor involved in that conversation as well.
Excellent, thank you. And with that, we will turn it over to Tiffany.
Great. Thanks, Corey, and thanks to Dawn for that foundation. We will shift gears here into talking more into the details around direct primary care and the considerations of having this model and who it's right for. So before you sign with a vendor, there's, I think, a few good strategic questions to ask and work through. So first will be centered around geography and access. These types of solutions are very regional in nature. So I think a good starting point is always, do your employees live and work near the providers that are available with that model? Map your employee population and their zip codes to the zip codes of those providers. The second question is, what are we trying to accomplish? What kind of health goals are we trying to accomplish? So that kind of aligns with your strategy and your culture. So with the direct primary care model, I think it's well suited for an organization focused on population health, who considers preventative care and chronic condition management, or for the organization that's wanting to be an employer of choice. In an unlimited model, like Dawn talked about, of that membership type style of direct primary care, that can feel like a rich benefit because we're removing the cost barrier. People can access that care as often as they need to. So this can also pair well with a group that maybe has yearly wellness screening. So many groups still have this in place to earn incentives. And so you can direct people to that model to get those yearly wellness screening visits. Thirdly, will be centered around your plan structure and what type of funding that you have in place. So for self-funded employers, because you have a clearer path to your claims data and the effects of that, you can have more measurable savings versus a fully insured employer. It may be hard to demonstrate savings in the near term. And so we typically suggest more of a voluntary or cost share model to have a kind of a lower risk entry point with this type of care. So let's shift gears to looking at telehealth versus direct primary care. We do still get questions on this quite a bit, so I think it's good to address the distinction between the two. And so for both of these models, we can access them virtually. And so like Dawn talked about during COVID and kind of telemedicine in general has been more and more adopted. Around 78% of hospital systems have some type of telemedicine or telehealth delivery. And then we see this in a lot of third-party solutions that we work with in health and performance. And when you're accessing care with telemedicine or telehealth, that's going to be a per visit type model with how the cost comes through, versus direct primary care is going to be a capped fee model where you can access that care as needed. Direct primary care is going to be very geared towards just the direct primary care services and not going to have as large of a care net as telemedicine can. Let's shift gears now to benefits of direct primary care. Sort of looking at the clinical case, of why we'd look at this type of model. So first, for preventative care. So when employees have unlimited, low barrier access to their primary care, they're more likely to seek care before problems become more serious and expensive. Second is the cost savings of that fixed fee model. Routine care can add up. And when people are using the direct primary care model for the primary care needs, we're directing them away from the health plan, which can, oftentimes show us savings because we're not running through, claims through that health plan structure. And third is that personalized care. So with that unlimited type model, the physicians don't have to take on as many patients. And so you're going to get longer appointment times. So you're going to have removing the barrier of the cost of care, the access of care. Hopefully your employees are going to go and build relationships and have kind of deeper trust, ask smarter questions, and participate in their healthcare better, which can give us better health outcomes in general. We do also see that sometimes these models can help reduce emergency care utilization, even urgent care utilization, because they have a place to go for a big wide net of needs. Now looking into how exactly does this model work? We get many questions about this, and I feel like it's pretty straightforward, and I love Don's analogy about kind of the gym membership, so it kind of similar thought process. So typically the cost of these types of solutions are going to be around $50 to $150 per month, either paid monthly, sometimes quarterly. You're going to be able to receive any type of primary care service. And then you're typically going to have both the brick and mortar option where you go in person, and then you're going to have that virtual access piece. Oftentimes these solutions will also offer a texting type model where you can text your provider in between visits. And so you can kind of access care as you'd like to, if it's in person or virtually. As a reminder, this does not build the health plan, and then there's no additional costs for the employee. And so it kind of removes that thought of, should I go receive care? How much is this going to cost me? How much money do I have in my HSA if I have a high deductible health plan? So you're not having to think about, any of the bills coming in, right? So you're totally removing that barrier. And then, lastly is that unlimited access. And so that kind of goes along with the cost. The more barriers that we remove, the more likely that those employees are going to seek care and hopefully get ahead of chronic disease states or just prevention in general. So how can we incorporate strategy together? And so, kind of looking first at prevalence, how often are we seeing these types of models? From the first time we talked to today's webinar, it's already grown. Looking at the number of direct primary care practices, there's over 3,000 that I could find operating in basically every state in the US. And we do continue to see a trend. Healthcare costs are not going down. So we all see that working in benefits. And so the same thing goes for a physician, right? Where they're more apt to go to this type of model because they're going to have, a set number of patients for them to see, longer appointment times where they can spend time with them. And then they're receiving that membership cost. And so their salary doesn't go up and down based on, sixth season, kids going back to school and those types of things. So I do see a benefit both on the provider side and on the consumer side. So I definitely see that this is a trend that's going to continue. So, like anything, I think it's good to talk about your strategy and your culture. What are you trying to accomplish? And then see if this is a benefit, that you want to incorporate in your current benefit strategy.
So, Tiffany, I have a question that I'm guessing many employers sitting here are also wondering about too. If they're just thinking that our populations are too spread out for this to possibly work, what would you suggest to them about direct primary care, and do they have any other options?
Sure. I still think it's based on one, the need, right? So if you have a population in diverse places that don't have direct primary care access as it is, right? If you have low amount of providers in your area, maybe you need that virtual piece of the direct primary care option. Going back to matching the zip codes of your employees and the providers, seeing how many employees you can cover, with that in-person access, and see if it is majority, then it could be a value to put that in place. So I think it depends on your needs, but yes, I think it is a better fit if you have, more people in bigger general areas. But that virtual piece can kind of be a gap filler as well.
Excellent, thank you. And now we are going to talk about paid leave and some of the tax credits with JJ. So JJ, take it away.
Awesome. Thank you, Corey. You and I have been talking a lot about how employer-provided paid leave has been in the news, where some large employers are cutting back on their paid leave programs due to cost. I'm really thrilled to be here today, as I think the paid leave tax credit through 45S and through this bill is another lever employers can consider to offset cost. So let's dive right into the policy background to the paid leave tax credit. So here are the changes. So now it has to do with the premium coverage. Employers that provide employer provided plans and the premiums can be considered as a part of a tax credit. And then also the pool of what could be considered has been expanded. So previous, in a bill that was introduced back in 2017 or 2018, the eligibility requirements for this tax credit was 1 year, and now it's been lowered to 6 months. And then a huge win for multi-state employers. So those that have employees in states in paid family and medical leave programs, previously those wages could not be considered, but now with this new bill and the changes, the top off or the extra portion that's paid through employer provided plans can be considered as a part of that tax credit. So why is this even worth it? First thing, I would just say it's a no-brainer. It's something that employers are already paying for. So it's an opportunity, it's another lever to recover costs on premiums that are already being paid. Secondly, the provisions within the bill, the tax credit, was something that was temporary. So as we saw different presidents, they kept extending this provision, but now with this change, the credit is permanent. And so it's something that employers can rely on year after year. And as I stated earlier, those multi-state employers, so those that provide 100% pay previously, if that employee was in that paid family and medical leave state, those wages could not be considered. But now the top off portion could be. So for example, if that paid family and medical leave program provided 60%, then the 40% of those wages that the employer is paying could be considered as the overall tax credit calculation. Let's move to the next slide. So you can see here that there's a different threshold of the credit rate depending upon the replacement level. And so to give you some numbers or some examples, let's say if your program as an employer provided 75% and you paid $10,000 in premiums as a part of that program, then you would be at the 18.75% threshold. And so you would get a credit of $1,875. So, I mean, thinking about that, that's extra dollars. It could be considered for privatizing paid family and medical leave programs, or perhaps you want to look at increasing your own leave benefit, let's say from 6 weeks to 8 weeks. So there's a lot of opportunities to gain credits through this provision. Next slide. Now let's dive into how the actual program works and the eligibility, leave types, and limitations. So you can see here that there's only certain leave reasons that can be considered as a part of the credit. And so the qualifying leave reasons are federal FMLA leave reasons. So your standard birth of a child, care of a spouse, your own health condition. So one thing to consider as an employer, if you cover leave reasons such as domestic partner, those would be wages that could not be considered as a part of this credit. And let's dive further, next slide, into the limitations. So what is it to qualify? So written policy, that's number one as a part of this. You must have a compliant policy that addresses several things. So your leave program must cover employees with a minimum of 6 months of tenure. And what I see a lot of times is that leave policies only cover full-time employees, but it's important to note here that it must cover at least employees of 20 hours per week. And I see that's where a lot of employers get tripped up on this piece of it. So make sure your policy covers those types. And then the leave amounts, your employer provided policy must provide 2 weeks of pay. And then one other point on the right side of the screen, the compensation limit, only employees that make less than $96,000 can be considered as a part of the credit. So that is another limitation there. And then lastly, I think it's important to consider your record keeping as a part of your assessment of this. So if you outsource your leave program, or perhaps you're doing your leave program today on spreadsheets, since you don't have good records, that's something to consider. So I would say have those conversations with your vendor, your carrier, to say, hey, I'm considering this. What can you do to help me with my record keeping as I do my tax credit and my calculations? So bringing this all together for you as a part of this, I think this is very timely, right? As employers are considering what's the return on investment of their leave programs. Because a lot of employers today, they're providing paid parental leave, they're providing caregiving leave. And so the first step is that policy, making sure that it is going to meet the needs of this credit. And then secondly, looking at, okay, are the wages that I'm providing as a part of my employer provided plans, do they actually meet the right level of credit? And then looking at working with some sort of tax professional as well, so engaging the right stakeholders, that would be an important part of this. Do you have a payroll tax person or perhaps a third-party tax professional that you can work with? And we can also work with you on this as well. And then measure, okay, if I do this credit, do I have enough federal credit? Is this something that's going to be worth me doing? Calculating it every year. But I do think it's a great thing to consider as you're looking at your overall program. And as you get questions from leadership on, okay, what's the return on investment? Not only it's helping you with your overall rewards package, but you're getting money back on dollars that you're already spending.
What would you suggest to an employer that they already offer paid family and medical leave, but they've never claimed the credit before?
Well, very, very important, that's a great question, is to consider would they even qualify. So it goes back to what's their policy today. And if they don't qualify, what are the levers that they're going to have to pull to say, hey, maybe I don't cover part-time employees, but with this credit, I'm going to have to with that 20-hour threshold. So what's going to be the added cost, right, of including extra employees under the policy? Is it going to be worth the credit that I'm going to get back? So honing in on that policy, that's definitely something that we can help you with. So please give us a call. That would be the first step. And then definitely thinking through, I always say, is the juice worth the squeeze on it? And just considering all the variables.
Very good. Thank you. I know employers will find this information very helpful. So now we are going to turn it over to Kim, who is going to talk about Trump accounts. And I know that we are already getting questions on Trump accounts. I feel like the market is very excited about them. So Kim, take it away.
Yeah, thank you so much, Corey. I like to refer to these programs as a baby bond because it really kind of tells a little bit more of the story of how it's been built and really kind of where we're going with this. And the reason we like to talk about the concept of a baby bond is it's not a new concept. It is something that a lot of municipalities, a lot of states, and other organizations, cities and counties have done for decades to try to solve inequalities or, to really provide some dollars where it didn't exist before. So the whole idea of a baby bond, having especially the seed money or the free money that's been given out to, these babies is really to get them on a path of equality, to get them to start building some generational wealth, to give an opportunity where one did not exist before. So really reducing some racial inequality, but encouraging savings. So imagine, free money being deposited into these accounts for these babies. That money gets to grow, and that American gets to see the value of compounded growth over time. So with this wonderful program is some education that's really going to, be maybe sometimes a first for a family to really understand these pieces. And of course, there's no question that a program like this is going to boost the economy. So let's do some quick math. I did some very off the cuff type of math, and there's roughly 3.6 million babies born in the United States each year. Now, $1,000 for each of those babies, my gosh, that's millions and millions of dollars, hundreds of millions of dollars each year that is going to be put into these accounts and therefore be deposited and invested in the market. So no question, it's going to start moving the economy a bit. But let's dig a little deeper into how these programs are set up. So when we talk about the idea of these baby bonds, now first and foremost, it's currently a pilot program for free money, meaning if you have a child that is born between January 1st, 2025 and December 31st, 2028, the federal government will be depositing $1,000 into that account once you open it up and set it up for your child. Now, that's great. Anyone who is not born in that 3-year period of time still has access to a Trump account and can open one up. They just don't get the free seed money. Now, this is a pilot program for the seed money, but if it turns permanent and it becomes something that is a constant for new babies born in perpetuity, that would be great. We just don't know what that really means right now as we're kind of testing the waters. Now, there are no income limitations of this program. So in other words, it doesn't matter how little or how much a parent has or makes an income, or even that child. The child doesn't have to have any income to receive any money or to even open up this account. So similar but different than other IRA type of accounts for a child. So, the idea is that parents can open up these accounts. It could also be opened up, frankly, by a guardian, an aunt, an uncle. It doesn't matter, but a responsible adult opens it up for one child, only one account. Now, in addition to any free money that might be given by the federal government, parents can contribute to this account as well, up to $5,000 per year. Now, there's no tax deduction made by that parent contributing to that, but it's basically the ability for a parent to maybe put some money aside for later for that child. And of course, employers, you could actually make this part of your benefit program to allow for up to $2,500 per year to go into this account. Now, it's tax-free to your employee. It's tax-free to the child that receives it. Well, actually, maybe tax-deferred is a better word. So what happens once it goes in, it actually gets invested and it grows. These accounts do become taxable later when that child is 18 and takes it out as distribution. Now, all other organizations can contribute as well, whether that be nonprofits, tribal organizations, state governments. There is so much chatter right now going on about the accounts. There's a lot of excitement that, a lot of nonprofits, big family foundations, and others are starting to think about how they can contribute to the benefit and to the future of today's children, especially these Americans that are kind of without right now. It's a great way to do it. So let's dig into a few more details about these. So one of the things about these accounts is it is truly supposed to be built for a child to allow for long-term growth. Now, in order to do that, there has to be some guardrails. So the money goes into the account. By the way, they're live. You can start them up today. But the money goes in, it gets invested, but it cannot be liquidated until that child turns age 18. Now, if the child does pass away for whatever reason, of course, it is available to be distributed. But while that child is alive, it is held down or locked down until they're age 18. And then at age 18, it actually turns into a traditional IRA account and subjected to all the normal rules and regulations of an IRA, which means that money can be utilized to pay for college or to buy a home, or it can just be liquidated for any other purpose, maybe to start a business. Certain of these parameters, of course, are going to incur some taxation. But the idea is that money is able to grow for all of this period of time. And there's a couple parameters that were very distinctly built inside of this regulation. And that is, just to be clear, there's only one account that can be set up per child. So whoever's the responsible adult sets up that child. Another adult, if they were to try to set it up, it will not be allowed. It will stop it based off the Social Security number. These accounts are only for U.S. born American citizens who have a Social Security number. That's important as well because that's one of the proponents of getting it set up. And of course, the IRS is actually contacted or has contracted with certain providers of these Trump accounts or baby bonds, as we're calling them. So everything's pretty easy on how they're set up. Let's really kind of dig into what information that is coming in from our nonprofits, though. So we've noticed that, as I mentioned, a lot of nonprofits or big family foundations or big benevolent organizations out there want to contribute to these accounts. So the Dell Foundation was actually the first organization out there that said, absolutely, we want to contribute to 25 million American children. That's amazing. Age 10 and under, so not just those first 3 years of babies, but basically what they're doing is they're saying, if you live in one of these zip codes where the median household income is less than $150,000, then the Dell Foundation will contribute $250 per child account that is set up. Now, they're the first ones in, so others I feel like are going to be jumping in as well. Now, if you live in Beverly Hills, sorry, you're probably not going to have any money added to your child's account. But for, really, lower income type of organizations, if the federal government's given $1,000 and, you're having a nonprofit that's given it, another $250 and some others and maybe an employer, that's real money going into the account, which is pretty amazing. So let's talk about what it takes to sign up for these accounts because it's the most important piece to understand. You need to sign up a child in order for the child to receive the seed money or for the child to receive any money from any of the nonprofits or employers. So how do you do that? Go to trumpaccounts.gov, best to do it on your phone. There's actually an app. You can go right to the App Store or to Google Play, download the Trump Accounts app, and then sign up. Now you will need a few things for this, so just kind of have it all ready for you. The parent or guardian, who's ever setting up this account, so remember, it could be a guardian, it could be a foster parent, it could be an uncle, whoever's got legal responsibility over that child. Your full legal name that matches your tax return, because they do some verification on that. The Social Security number of the parent or guardian who is setting up the account needs to be entered. The name of the child, the Social Security number of that child, and then some sort of ID verification. So when I went to go set it up to test it, I had to upload a copy of my driver's license, take a photo, and then a selfie, I guess, just to be able to show that I matched the ID. So once you set those up, pretty simple scenario, it is set up for you. You have the account, you get a confirmation, and then you can then start contributing your own money to the account or to that child's account or, waiting for that free money to come in. So let's talk about what it really means to have growth. When we have this free money coming in, it's going to grow for up to 18 years for certain Americans. So let's look at some just basic numbers. Let's say that we're looking at just the original seed money that came in, that $1,000, that one time only, no additional money is added throughout the 18 years of that child. At age 18, with a very modest S&P 500 growth, that 18-year-old is going to have $6,000 in their account. It's pretty amazing. You know, just a good seed money, that's a great way to start with college or maybe to buy a home. It's a good down payment. Now, if $250 is contributed on behalf of that child's account every year, not per month, per year, then it grows to $19,000. That's real money. And my gosh, if $5,000 is contributed every year, think uncles, aunts, grandparents, instead of getting birthday gifts for your kid, you know, maybe they can throw a couple dollars, extra dollars into your child's, you know, baby bonds account. That could actually grow to $270,000 at age 18. That's real growth. Let's look at age 27. Same numbers, same parameters. Contributing nothing, it grows to $15,000 if you wait until they're 27 to liquidate. If you contribute or have contributed on their behalf, $250 a year, $51,000. And my gosh, if $5,000 per year is contributed each year for 27 years, you will have about $750,000 accumulated. And let's get crazy. Let's say that this, child doesn't use any of this money and at age 55 has just let it ride and let it grow. Let's show what that's going to look like. Remember, $0 added more than the federal government. We now have $243,000 accumulated. That's the power of compounding. One-time deposit, actual annual growth. Money makes money. Look at it if you contributed $5,000 a year each year for those 55 years. $13 million, that's unheard of. That is just a number that doesn't even sound right. The math works, it is right, but it really is just amazing when you start to think about if the child is going to use this for college, that's great, they're probably going to liquidate it. But if they get scholarships or if they find out they're going to go to trade school, or maybe there isn't a real big cost for college or they don't need it to buy a home, letting it ride and let it to continue to invest is going to have some really amazing value. So it works, it is important, and it will be beneficial. So let's just kind of close with a couple topics of things that we don't quite know just yet when it comes to the details. We have some things unresolved, and these things are changing, by the way, by the day. Yesterday, when I was looking at this, we saw some changes coming through, which means we now actually have investments that are available to invest in. We have a default investment. So if you build an account for your child, but you don't choose which of the currently 5 investments available, there's a default. That's just an S&P 500 ETF, super cheap investment that's going to buy the market. Easy. We know who the providers of these accounts are. When the initial deposits are going to happen, we've been told that they will happen now. But when's now? I haven't heard anyone who's received it. I don't have a baby. Mine is almost 17 years old. So I'd be curious to hear who's seeing these deposits. But if you make your own deposit, those are happening in real time. We do not know how an employer is going to facilitate adding money to these accounts. There needs to be some sort of link between an employer contribution and that child's account. Maybe that's through payroll withholdings, tax withholdings. I don't know. We still need to wait for guidance on that. So if you are an employer and you want to say, you know what, this is a great benefit program, we want to add it, to our employees' benefit programs, that's great. How do you get there? We have no idea. So hold tight. I would say a good idea is to start thinking about these things, and we can work through the details as it comes down. The big piece is going to be in order to receive nonprofit deposits, do you actually have to apply? Will it be automatic? That's to be determined. I would say if there's any free money to be obtained, my gosh, fill it out. Take that time, spend the energy to get it. It is free money where possible. Right now, the account is only allowed to be invested in company stock investments. That's how it was built. But is there room for bonds or international categories to be added in the future? Maybe. Congress is considering it right now. And then the big question we just don't know is, what about these means-tested programs already in existence? Some of these programs like SNAP, Medicaid, or FAFSA have some requirements that if you have investments or if you have any assets, your benefits could be reduced or, could be limited. So I know Congress has taken this on. It's a very big idea right now. So hold tight. That is something that I think they're going to kind of work through. The benefit, of course, going to the last slide for me is, as an employer and you're thinking about whether this is something that should be added, to your benefit program, there's a couple things really to consider. You know your employees best. If all of your employees are in their 30s and 40s, there's probably going to be a lot of babies. Maybe not, maybe. So maybe this is a good program that would see some value to your employees to be able to retain and hire those great employees. If most of your employees are over the age of 55, 60 years old, maybe it's not that great of an idea unless your employees are trying to do this for grandkids. So think about your employee base. Think about how you work it into all of your budget. Maybe even survey your employees so you can really see this is what they're looking for and this is how we can kind of make it work. I'm going to toss it back to you now, Corey.
Kim, you're not going to get off that easy. I do have a couple questions for you. So, one, it sounds like maybe it's a little too soon for employers to actually start contributing at this moment. Is that accurate?
100% accurate. It is fast and furious with these changes. There has to be a link. Now, by the way, not to get on an offshoot here, but there is also some other pieces of legislation that's out there that are building a government employer direct link on other items in regards to retirement planning and employee accounts. So there's a lot of tech happening right now with the federal government. So there's a lot of eyes and a lot of money going towards this. So it is something not available today, but I wouldn't be surprised as within 3 months or 6 months, there is some way for an employer to be able to say, hey, I'm going to send this in. Here's the account. Here's the link. Here's how I send it. Here's the employee's information that they have to provide on who that account is titled in and what the Social Security number is.
That makes complete sense. One other question that I know employers are probably wondering is, do we have any sense of whether or not the non-discrimination rules that apply to health and welfare plans, but also retirement plans, are going to apply here as well?
Yeah, that actually just came out in guidance that yes, just like all benefit plans that, Tiffany and Dawn talked about, you do have some non-discrimination requirements that apply. Now, it's going to be on the same type of parameters. However, stay tuned also, because there is a lot of conversations out there in Congress and others to be able to say, you know what, if you have a flat dollar amount, call it $2,500 that you want to apply to your employees, could they choose that they want it to go in a Trump account or baby bond? Or could they choose to have it go into their 401k? Or could they choose to go into an IRA? So a lot of things are kind of changing as we go through this, but the rule is always going to be you can't give it to some employees and not all, or at least offer it to all.
Very interesting. Thank you. I'm sure in coming weeks and months we'll get more answers to these questions. But in the meantime, great information. Thank you very much. Okay, now let's move forward with our key takeaways and next steps. Okay, so sometimes I like to describe the benefits environment as a puzzle. And the more pieces we add to our puzzle, such as telehealth and high deductible plans and direct primary care, the more complicated our puzzle gets and the greater importance compliance plays as well. If our puzzle fits together today, we start adding pieces, we need to make sure that our puzzle still fits together and, of course, is compliant. Direct primary care, it can be a very valuable tool, but it's also important to evaluate that tool. It's also not necessarily the right tool for every job. One thing I would suggest is that if you're looking at direct primary care, look at direct primary care in a broad sense rather than specifically looking at a vendor. I would say understand whether or not it is the right solution for you before then moving on to who is the right vendor for you. Paid family leave is an incredibly important topic. It is going to grow. I think JJ really hit the nail on the head here by highlighting the potential tax credits that are available to employers if they offer that paid family leave. Again, the federal government is very clearly incentivizing employers to offer paid family leave by providing these tax credits. Trump accounts, I think these are a great solution, not only to help fund education and other expenses for the children of America, but also for employers to potentially employ as part of their benefit strategies. Again, of course, making sure that they are conscious of the non-discrimination rules that are going to apply. And then down at the bottom, compliance, I tend to think of these compliance obligations as the bare minimum for what employers need to be doing. There's always going to be the opportunity to go above and beyond. So if we think about, any kind of compliance requirement where maybe we need to provide a summary of material modifications, yes, you could do that, and maybe you need to do that, but maybe an employee-facing communication that's a little less formal than a summary of material modifications could also possibly be used in addition. Why would we do something like this? Because again, that summary of material modifications could be the absolute floor. Yes, it is going to be required in many instances, but also let's communicate to our employees in a way that might be a little bit more accessible to them. And then let's wrap up with talking about some actual next steps. So what can employers actually be doing here? So first and foremost, make sure your house is in order from a compliance perspective. Make sure that if you're adding direct primary care, that it's meeting the thresholds for integration with a high deductible health plan. So as Dawn talked about, those annual cost limitations, as Tiffany mentioned, some of the service limitations there. Also, your dependent care FSAs, understand whether or not you have increased that contribution limit. Just because the IRS allows the contribution limit to be increased does not mean that all plans did or necessarily have to. And then understand how that impacts your non-discrimination testing as well. On the absence front, again, this tax credit is available now. I think it's important for employers that haven't been claiming it thus far to understand, does their program meet the requirements for claiming it? If not, are there changes that can be made in order to become eligible for that tax credit? With regard to direct primary care, again, understanding the solutions that are available, and then also what solution is right for you. On the retirement side, and particularly the Trump account side, I would say wait for more information. There's going to be a lot more information that is forthcoming. But that being said, if this is something that you want to include as part of your 2027 benefit strategy, I would certainly be thinking about it now. And then, of course, fingers crossed that more information, especially on that nexus between employers making contributions to accounts where the employee is the responsible individual or the employee's child has the account, I think will certainly be more helpful. So fingers crossed that that will be forthcoming by then. Today's conversation covered a lot of important ground. We know that this was a lot of information. I hope, though, that you're leaving here with a more clear view of the landscape and a concrete sense of what to focus on next. If today's conversation raised any questions about where your organization stands on any of these, or if you have any questions on the items that we discussed, we are here to help. Everyone who registered will receive a follow-up email with a link to the recording, as well as a PDF of the presentation, along with a few other related resources. And for those of you in attendance today, that email will also include information on your continuing education credits. But before we leave you, we just have a quick note about the next two installments in our cost management webinar series. Coming up on July 22nd, we have From Projections to Planning, Making the Most of Hub's Benefits Cost Trends Report. In this session, our actuarial and financial experts are going to break down in simple terms where healthcare costs are heading and why, and how to translate those projections into smarter planning decisions. Hopefully you can walk into budget season and open enrollment with clarity and confidence. And then on July 29th, we have Beyond Fully Insured, Alternative Benefits Funding Strategies for Small and Mid-sized Employers. This session will explore the funding alternatives that give smaller organizations the same cost control tools that large employers have been using for years. These include level funding and stop-loss captives, as well as reference-based pricing. Whether you're just beginning to ask questions or actively evaluating your options, this session will give you a realistic picture of what a path forward could look like for your organization. If you'd like to register for any of these sessions, simply scan the QR code on your screen now. We'll also include more detail on these webinars in your follow-up email. And finally, before you sign off, please take a moment to complete the brief survey that will appear on your screen. Let us know whether today's topic was valuable and what you'd like to hear more about in the future. Again, your feedback is very important to us. On behalf of Hub International, thank you for joining today's webinar. This now concludes our broadcast.